Pfizer-BioNTech's mRNA vaccines are the first ever vaccine to have secured an emergency use authorization from the FDA in the Philippines. While they are not the first vaccine manufacturer to have signed a deal with our country, nor are they sure how many of the vaccine can they send out, this deal, this contract is really promising. While our government and health officials are so confident of this vaccine, not all Filipinos are. Most of our people are very skeptical. Some would even pledge not to take it as it might cause further health complications that ranges from simple COVID-19 symptoms to pure conspiracy theories. The point of these vaccines is to immunize you against a virus or a bacteria. Traditionally, there have been four types of vaccines, two of which are very common today, involves exposing you to a weakened or a dead version of a virus. The other is of least common type, which does the same thing as the other two, but instead of using a virus or a bacteria, it uses an inert version of a toxin. The fourth type is fairly common and is different from the others mainly because it only uses a part of a pathogen. It won't generally make you sick, but it will be enough to teach your immune system how to fight the virus or bacteria once it starts invading your body. Most of our COVID-19 vaccines and trials today utilizes this method. However, what's difficult with all these four types of vaccines is that they would all require huge amount of time to grow huge amount of pathogens in a lab, which is not very ideal for our emergent situations like in today's pandemic. Luckily, the global health community were quick enough to respond and were able to make research studies and develop vaccines. Hi, I'm Justine, and in today's discourse, we will be talking about one specific vaccine type, mRNA vaccines, what they are and how they are safe.
As the UK has launched a world-first trial that has become
Initial vaccine rollout will begin covered by 3 days after the arrival of the actual vaccine doses.
COVID-19 vaccine.
Before we can talk about this vaccine, let's first explore how SARS-CoV-2, or simply called COVID-19, invades our body. If you're like me and you've been around the internet for the entirety of the pandemic, you probably already know what the coronavirus looks like. It is round and it has spike-like grounds. These spike-like grounds are called spike proteins, and these are what lets the virus sink itself into our body cells using molecular deception to hijack our body. These spike-like grounds are what also gave coronaviruses their names, corona, ground. It is what our immune systems uses to feel for, to identify if it is a foreign threat and if it should attack or not. Today's vaccines for COVID-19 were developed by scientists to only use these spike proteins. What's amazing with these vaccines is that when they're injected, they're harmless. How is this possible? The vaccines for COVID-19 that are on trials today were developed using only the genetic code or instructions to create these spike proteins. This type of vaccine is called mRNA vaccine. mRNA or RNA is a single-stranded copy of the DNA of the virus. Each strand holds genetic instructions to create proteins, which are needed to create these spike proteins. Since it involves genetics, you may be asking if it is generally harmful for our body. Don't fret. The mRNA inside the vaccine are only RNA to make the spike proteins and not actual RNA to make actual virus. It will not infect you or give you SARS-CoV-2 pathogens, nor will it get into the cell nucleus or change and mutate your DNA. This vaccine gave enough assurance that it will be safe for immediate clinical trial, which resulted to its immediate approval. Now that you know that these RNA vaccines are safe, you might be wondering, how did vaccine manufacturers make it so fast? Well, there are two things that made it possible. First is funding. Lots of funding. Because we are in an emergency situation, it is not hard for people to feel the need to help, especially big money people like Jeff Bezos and Bill Gates. We're not gonna run out of money any soon, at least for billionaires. Second thing is that the development process of these vaccines were compressed and clinical trials were overlapped in a timeline. The vaccine developments for today are the same as the vaccine developments from the past. The only difference is that the clinical trials, the phases, were being done simultaneously, making it available for manufacturing in less than a year. The vaccine development may be fast-paced, however, no conformity and safety measures took place, which assures us that the vaccine's clinical trials, or the vaccine in general, are safe. Fairly recently, on December 10, 2020, the New England Journal of Medicine published the results of Pfizer's phase 3 study. The data from its 43,448 participants, half of which received the actual vaccine and half received the placebo, have shown that with 2 recommended doses and with 21-day interval, the vaccine proved to be safe and demonstrated 95% in efficacy in preventing COVID-19 in humans. With regards to age, gender, ethnicity, and physiology, as long as they are not infected with COVID-19 7 days before and or after administering the inoculation. While you may be experiencing mild pain symptoms at the injection site after vaccination, studies have shown that you won't be experiencing anything more than that. There are also no current evidences that suggests any long-term side effects. There may be possibilities for rare side effects, but they will be very rare and be very highly unlikely. So in summary, we now know that mRNA vaccine is 95% in efficacy and is generally safe for us to take. This feat is really, really promising. As of current, Pfizer-BioNTech's mRNA vaccine are still on its last phases of trials. However, they are already manufacturing and distributing doses to countries and health communities. Unfortunately, our country is yet to receive our own doses, and while our vaccine rollouts are still on its way, it is important that we are still doing the same jobs we were told before. Wear masks, avoid going outside, stay safe and healthy. Thank you.